Hello, I'm Dr. Hussain Iqbal. I'm an orthodontist and dentofacial orthopedist. I also specialize in smile design and implantology. I've been working with COSMODENT India, Bangalore, Gurgaon and Delhi. A very common question, and there are so many factors because of which a tooth gets decayed. Prevention of all those factors will eventually lead to the tooth being saved from getting decayed. Let's discuss each factor one by one. Let's try to cover most of the factors. Now, the most important factor is sugary items, not just for our overall health, even for the health of our teeth. Sugars are not a very great thing. So, to reduce the intake of sugars, especially sticky sugars, it's very important. Chocolates and sticky sugars like candies, they are the biggest enemies for your teeth. How so? Because the sugars, especially the sticky sugars, once they get stuck in between the teeth or in areas that are not so cleansable, those very sugars, they act as food for the bacteria. All the oral bugs, they feast on those sugars, and eventually the byproduct that they release, those are acids. Those acids, they start cavitating your teeth. They start making small cavities in your teeth. Initially, those cavities are so microscopic in level that one may not realize them. But as time passes by, the spots, they become larger and one starts seeing discolored teeth. Still, one doesn't want to do much about it. But when pain is experienced, that is when usually most of the people address it. So that is a different story, but sugars are the most important culprit that one should be worried about and get rid of in their diet. And whenever someone consumes sugar, they should thoroughly clean their mouth. Second important factor is to clean your mouth. It can be done with the help of brushing daily. Twice daily is recommended. 2 to 3 times is even better. The amount of time that one spends on toothbrushing is also very critical. It's not about just brushing your teeth. It's about how well do you brush your teeth. So we must take at least 2 to 3 minutes from our busy lifestyles and give importance for our teeth to be cleaned properly. Usually circular motions are preferred while brushing your teeth in the front teeth region. And there are certain toothbrushing techniques that are relevant for the back teeth area, where you engage the bristles in a certain angulated fashion and then you start removing all the debris, because ultimately the purpose of toothbrushing is not just to rub your teeth or to brush your teeth. It has to be about removing all the decay and the debris from your teeth, from your daily consumption of your food. So cleaning the tooth properly is the key to maintaining your teeth well and not getting tooth caries or tooth decay. Along with toothbrushing, flossing also goes a long way. So instead of using conventional that threaded floss, these days more popular and more efficient is water flossing. You can buy this device which is called a water flosser, which helps you to clean your teeth, the spaces between the teeth, with the help of a jet of water under pressure, and that removes all the debris and decay. And it's also quite easier to use, more user friendly, especially in the patients that have implants or bridges in their mouth, any kind of prosthesis. For them it works wonders. So a water flosser is a good option for maintaining oral health and to get rid of dental decay or prevent it. One may also take help of motorized toothbrush. The toothbrushes that have a rotary action, not the oscillating ones so much, but the rotary action. So instead of using a manual way of brushing your teeth, the rotary toothbrushes adjusted on certain speeds can help you clean your oral cavity in a good way. Then one more way of going for a good amount of prevention in terms of dental decay is use of fluoride varnishes or fluoride gels. Your dentist will provide you with sessions of fluoride gels. There are certain ages during childhood when fluoride treatment can be done. High concentrated of fluoride in the tooth region for a certain time, if provided, can help remineralize the tooth that has been getting decayed because of the bacterium. So the remineralization process is really superb with the help of fluorides. That can be definitely practiced. Even fluoridated water is one concept for remineralizing the teeth, but there are certain disadvantages to that. So one may ingest the water and there may be complications associated with fluoridated water there. So topical fluoride application is a safe way of remineralizing the teeth and preventing dental decay. Fluoride gels, fluoride varnishes. Other than fluorides, one more very popular way of dealing with tooth decay is sealants, teeth sealants. So there are certain areas of the teeth, like suppose if we look at a tooth, it's like mountains and valleys, and whenever these valleys they get very narrow, it's very difficult to clean them. Even the fluoride treatment, the fluoride doesn't penetrate in those valleys. So it's always better to reduce those valleys into flat areas. That is what is done with the help of sealants. So what we do is we remove all the dark spots and the dark lines where the infection has just started, maybe the initial parts of infection, or even if the infection has not started, we make those areas slightly wider so that they are cleansable, and we seal those valleys, we seal those grooves with the help of dental sealants. So sealants is a good way of helping or for preventing any kind of dental decay in the future. One more way to go for dental caries prevention or to avoid tooth decay is to go for dietary modifications to change the way one eats. One can shift to more healthy sources of food, more healthy diet like fibrous food, and less of sugar content, less of carbohydrates. So that also helps wonders. Also you can increase a lot of water intake. That is, more water if you take, it keeps cleaning your mouth. Also the kind of saliva that you have in your mouth, that also changes. The consistency of the saliva changes. From a thick kind of a saliva, it becomes more watery, and it helps to self cleans the mouth, and the chances of dental decay reduces drastically. So all these different ways of preventing dental decay, if attended and addressed at the right time, they can really make wonders. And the studies have shown that almost 95% of dental decay can be prevented if all these dental techniques can be utilized. The final advice would be that to visit your dentist every 3 to 6 months. It's very important, because dental decay, it's a progressive disorder. It's a progressive thing. So it's not that it starts and it finishes. It's in complete dynamics all the time. So every time when you get it checked, there might not be something existing 1 year back, but now there might be a big lesion. So it's always better that you visit your dentist more frequently, discuss with them the needs for dental caries prevention, and always be proactive and inquisitive on your part to convey that you are concerned about your dental health. So definitely I would believe that your dentist will help you with all the caries prevention and the decay prevention which can happen in your teeth, and give you different techniques related to it. Thank you.